So, our presentation is on Mexican cultural diets and how it relates to healthcare. Mexican culture. The word Mexico is derived from Mexica, the name of indigenous group that settled in central Mexico in the early 14th century and is best known as Aztecs. Spoken by more than 95% of the population, Spanish is the official language of Mexico and was introduced through conquest and colonization. Roman Catholicism is a dominant religion in Mexico, and as you can see in the picture above is the Lady of Guadalupe, which is Mexico's patron saint, and on the right is a picture of typical cathedrals that are seen in Mexico. Mexico possesses an extensive and sophisticated culinary culture. 3 products constitute the heart of most Mexican dishes: corn, hot peppers, known as chiles, and beans. Corn is consumed in all possible forms, as a cooked or roasted corn cob called elote, cooked grain or corn porridge, known as atole, and as wrapped and steamed dough with filling, also known as a tamal. But most importantly, is a tortilla, a thin and round pancake-like. A large percent of the Mexican culture are low income and do not have the resources to obtain healthy foods. More likely to live in a rough neighborhood where fast food establishments and liquor stores are highly populated. Dietary habits. The typical Mexican cultural diet consists of high saturated fat, low protein, and low fiber intake, along with an increase in consumption of carbonated drinks and sweetened beverages, and have an overall daily water intake below the recommended level. Majority of the dishes are fried with oil or lard. Mexicans generally have a light breakfast of coffee and or fruit before they leave for work or school. The most important meal of the day is served between 2 and 4 in the afternoon and consists of 3 or 4 courses, if affordable, accompanied by tortillas and refried beans and dessert. Dinner is served between 8 and 10 at night and consists mainly of sweet rolls, coffee, and milk. Mexicans drink huge quantities of alcohol, and it is common for children at a young age to drink coffee. Children are forced to eat in order to gain a fuller, healthier figure. Impact on healthcare. The unhealthy diet and sedentary lifestyle the Mexican culture adheres to increases the risk for developing diseases such as hypertension, diabetes, heart disease, cholesterol, among others. Healthcare is majorly accessible to those that can afford a clinic or a hospital visit, and those who cannot afford it recruit to other means or do not seek medical attention at all. Since most medicines can be purchased freely in commercial pharmacies, Mexicans tend to consume medication in considerable quantities due to their easy access. In addition, several folk health providers exist and have a regular clientele. The use of herbalists, known as hierberos, and bone and muscle therapists, known as hueseros and sobadores, are usually used in place of healthcare practitioners or chiropractors. The belief of Mexican culture that curanderos, hierberos, hueseros, and sobadores heal their diseases prevent them from seeking professional medical attention, which can be dangerous and can lead to further complications that will later be more difficult to treat. In the pictures seen here are 4 types of folk healers in the Mexican culture, such as curanderos, hierberos, hueseros, and sobadores. The first picture on the top left is a curandero, and the second picture on the top right is a hierbero. And these 2 folk healers focus more more on the spiritual health of an individual and use incense or plants in order to get that individual to a healthier state. The lower left picture is a huesero, and it's more of a chiropractor. They typically put bones back into place if dislocated. And the picture on the lower right is a sobador, and it's more of a masseuse and massages. And all of these folk healers, as you can see in the picture, they see their patients or their clientele in their home, typically.
NCLEX style multiple choice questions. Question number 1. Nurses can best help Mexican clients initially prevent hypertension by teaching A. Cut sugar and refined carbs from diet. B. Exercise and maintain weight. C. How to maintain a normal blood pressure. D. Eat plenty of dietary fiber. Answer to question number 1 would be C. How to maintain a normal blood pressure. The rationale would be to monitor and record the blood pressure, measuring both arms and thighs 3 times, 3 to 5 minutes apart while patient is at rest, then sitting, then standing for initial evaluation. Use correct cuff size and accurate techniques. Question number 2. Which of the nurse's statements is most likely to help a 20-year-old obese male in losing weight on a 1,000-calorie diet? A. You are likely to notice changes in how you feel with just a few weeks of diet and exercise. B. To maintain weight loss, it will be required to make permanent lifestyle changes. C. By losing weight now, you will lower your chance of future health problems such as diabetes. D. The majority of the weight you lose during the first weeks of dieting is water weight, not fat. Answer to question number 2. It is A. You are likely to notice changes in how you feel with just a few weeks of diet and exercise. The rationale is motivation is a crucial component of weight loss success, and a quick result boosts motivation. Future health concerns are unlikely to motivate a 12-year-old patient.
Obesity. Nursing diagnosis. Imbalanced nutrition more than body requirements related to food intake that exceeds body needs, as evidenced by weight gain and elevated BMI of 30. SMART goal. Patient will state and plan to monitor weight within 24 hours of discussion. Patient will have a target of 5 pounds weight loss every 30 days. Patient will demonstrate a change in eating patterns and involvement in individual exercise program. Interventions. Nurse will help set realistic goal for losing weight. This will aid for positive reinforcement and reduce frustration. Discuss patient's normal food preference to evaluate eating habits and include preferred foods in patient's diet that are nutritious. Diabetes. Nursing diagnosis. Risk for unstable blood glucose related to inadequate blood glucose monitoring. SMART goal. Patient will maintain blood glucose level within normal limits within 1 week. Patient will acknowledge key factors that may contribute to unstable glucose levels. Interventions. Will monitor patient blood glucose levels before and after meals daily. This will help to identify glucose levels in order to make necessary diet modifications and keep laboratory values within normal limits. Will provide patient with information regarding modifiable risk factors. Knowledge of risk factors will contribute to informed decisions about lifestyle changes. Hypertension. Nursing diagnosis. Risk for decreased cardiac output related to altered preload and altered afterload due to vascular resistance. SMART goal. Patient blood pressure will be within normal parameters within 1 week. Patient will maintain weight within normal BMI limits in 60 days. Patient will participate in activities that reduce BP cardiac workload. Interventions. Will monitor patient at least every 4 hours and report immediately any irregularities in blood pressure. This will indicate impending cardiac failure or other complications. Will maintain dietary restrictions as ordered. This will reduce risk of cardiac disease. Note presence, quality of central and peripheral pulses. In conclusion, In conclusion, dietary habits of the Mexican culture are high in fats, carbohydrates, and alcohol. Due to low income, families are unable to afford health care and purchase affordable food options that are healthy. Curanderos, hierberos, huseros, and salvadores are used in place of medical professionals in order to provide care. Due to Mexican culture dietary habits, it increases their risk for disease such as diabetes, hypertension, cholesterol, and cardiac issues that may lead to death if not treated properly. Children began drinking coffee at a young age and are forced to consume meals prepared by family in order to obtain a fuller, healthy figure. Due to pharmaceuticals being openly available, the culture purchases and consumes large quantities. In practice, the nurse will educate patients and families on healthy food options, as well as provide pamphlets with the information in their language, will refer to nutritionists if necessary, will provide resources for patients and family to obtain healthy food, example WIC, Food Stamps, food banks, will educate patients and families on health-related issues caused by bad dietary habits, will instruct patients not to purchase or consume large quantities of medication due to the accessibility, and educate on the importance of not self-prescribing medications, will provide resources to receive care from medical professionals. Medi-Cal, Medicare.